Hi, this is Dr. Rex Hamilton. I'm the medical director of the UCLA Laser Refractive Center. Thanks for checking out this list of frequently asked questions on cataract surgery. I'm often asked what type of anesthesia will be used for my procedure, and will I get an injection in my eye? We typically do not use an injection for anesthesia for cataract surgery. In fact, we use topical numbing drops, and we give you IV sedation. This is really great because it allows you to see out of the eye immediately after the surgery. I'm also often asked, will I see something coming towards my eye during the surgery? There's a bright light that you'll be looking towards during the surgery. You may see some instruments coming into your field of vision, but they'll be very blurry and will not be alarming to you. I'm often asked, will I be present for the entire surgery and will students be training on my eye? I'm always present for the entire surgery. There will usually be a student, resident, or a fellow present in the OR during the surgery, and sometimes a resident or fellow will assist with the procedure. A very common question is, how successful is cataract surgery? Cataract surgery is actually the most commonly performed surgical procedure in the United States, with more than 3 million procedures performed each year. More than 99.5% of cataract surgeries performed on patients with otherwise healthy eyes result in best corrected vision that is improved from before the surgery. Other than LASIK, there are very few other surgical procedures in medicine that offer that level of success. Of course, a very common question is, what are the risks of the procedure and what is the likelihood that these risks can occur? Anytime we do surgery, there's always a risk of infection. For cataract surgery, that risk is about 1 in 2,000. By following our instructions, the risk is actually even less than 1 in 2,000 in our practice. The retina, which is the film in the camera in the back of the eye, can develop a tear after the surgery, which can on rare occasion lead to a retinal detachment, which is like the wallpaper coming off the wall. This is a very rare complication that could result in loss of vision and require an additional surgery to repair that. The risk of that is about 1 in 500 in patients that are nearsighted, developing a retinal tear, and much, much less in farsighted patients. The retina can also develop some swelling back here called cystoid macular edema following cataract surgery, particularly in patients with poorly controlled diabetes. This can lead to blurred and/or distorted vision. The risk of CME, or cystoid macular edema, is about 1 in 500. The eye drops that I prescribe for you serve as a prophylactic measure to reduce this risk. Sometimes patients have some near or farsightedness together with astigmatism following surgery that requires spectacles for the best vision. If you have elected astigmatism management or refractive management, there is a 10 to 15% chance you will need a fine-tuning procedure, which is either LASIK or PRK, to optimize your vision without glasses. Patients are often curious as to the recovery time from cataract surgery and what they can expect to see after the surgery. You're going to be able to see right after the surgery, immediately when we're done, and the eye will feel essentially normal the next day, except for maybe some foreign body sensation, scratchiness. Depending on the severity of the cataract, the vision will improve rapidly after surgery. If the cataract is very mild, the vision will likely be excellent the day following surgery. If the cataract is advanced, it will take several days to a week for the vision to improve. Macular degeneration and glaucoma are very common, and sometimes patients ask me, if those run in my family, should I be concerned? Macular degeneration is when the retina, again, the film in the camera in the back of the eye, is not functioning properly, and the central vision can be mildly or severely affected. This is completely independent of having a cataract, a cloudiness in the lens of the eye. So the retina is here, macular degeneration affects this, the cataract is here, a cloudiness in the lens of the eye. So removal of a cataract can improve the vision. It does not fix the macular degeneration, but the overall visual function is often better. Glaucoma is a dysfunction of the optic nerve, which connects the eye with the brain. Typically, glaucoma occurs in eyes with elevated pressure. Unlike macular degeneration, it affects the peripheral vision first and only in advanced stages affects the central vision. Glaucoma also is unrelated to cataract, and in fact, cataract surgery often results in a lowering of the intraocular pressure, which is favorable for glaucoma. Accordingly, cataract surgery is very much advisable for patients with glaucoma.